Do you often wake up multiple times a night to use the restroom? Maybe you experience leaks or that constant urge to pee. If so, you're definitely not alone. Millions of people deal with bladder issues, and it can be incredibly frustrating. Your bladder is a muscular sac that stores urine until you're ready to empty it. The receptors in the bladder wall act like pressure sensors, sending signals to your brain when it's getting full. When you're ready to go, your brain tells the bladder muscles to squeeze and the sphincter muscles to relax, allowing you to empty your bladder completely. But hold on, there might be a surprising factor affecting your bladder health: vitamin D. And did you know that your bladder has receptors for vitamin D? These receptors are concentrated in a muscle called the detrusor muscle, which is key for proper bladder function and helps you empty your bladder completely. So, when your vitamin D levels are low, those receptors can't function optimally, potentially leading to many bladder problems. Let's explore some ways a vitamin D deficiency can affect your bladder health. Number 1. A higher risk of urinary tract infections. Vitamin D helps keep your immune system strong. When your vitamin D levels are low, your immune system might not fight off bacteria as effectively. This can lead to inflammation and urinary tract infections. Studies have shown a clear link. People with low vitamin D levels are more likely to experience UTIs. A study published in the Journal of Urology found that women with vitamin D deficiency were 3 times more likely to get UTIs. Another study showed that adults with sufficient vitamin D levels had a 39% reduced risk of UTIs compared to those with deficiency. Studies show that low vitamin D can disrupt the balance of good and bad bacteria in your gut, and it can also weaken your body's natural antimicrobial defenses. This creates an opportunity for harmful bacteria to invade the lining of your urinary tract, causing an infection. UTIs are more common in women, especially during their pregnancy, but children and adults are also susceptible to UTIs linked to vitamin D deficiency. Number 2. A higher risk of lower urinary tract symptoms and overactive bladder. We've all experienced that occasional gotta go feeling, but when it becomes constant or disrupts your daily life, it can be a sign of lower urinary tract symptoms, or LUTS for short. This includes things like frequent urination, urinary urgency, or that gotta go right now feeling, waking up at night to pee or nocturia, incomplete bladder emptying, and even urinary leakage. LUTS can also lead to overactive bladder, which is that sudden, intense urge to pee, sometimes with leaks. All of that can happen due to vitamin D deficiency. Remember those vitamin D receptors in your bladder muscles? When your vitamin D levels are low, these receptors can't function as well. This can lead to bladder muscle dysfunction, inflammation, and difficulty with bladder control, all of which contribute to LUTS and an overactive bladder. In fact, studies show that children with vitamin D deficiency are more likely to develop bedwetting and OAB. Plus, vitamin D deficiency has also been found to be more common in men over 50 who have an enlarged prostate. Number 3. Vitamin D's potential link to bladder cancer and other issues. This is where things get a bit more complex. Vitamin D seems to play a role in regulating cell growth and development. When vitamin D levels are low, this regulation can go bad, potentially leading to abnormal cell growth and even cancer. In fact, a large analysis of multiple studies involving over 62,000 participants found a potential link between low vitamin D levels and an increased risk of bladder cancer. It's important to note that this doesn't prove vitamin D deficiency causes bladder cancer, but it suggests a possible connection that needs further investigation. Now, let's explore the positive side. Vitamin D can significantly help improve your bladder function in several ways. Number 1, it can help your body fight UTIs. Vitamin D plays a crucial role in your immune system's defense mechanisms. It helps regulate the production of cathelicidin and other antimicrobial peptides. These act like natural antibiotics, patrolling your urinary tract and fighting off harmful bacteria that can cause UTIs. Number 2, it can strengthen your bladder lining. A healthy bladder lining acts as a barrier, preventing leakage and infection. Vitamin D helps your body produce proteins that strengthen the connections between the cells in the bladder wall. This creates a tighter barrier, making it more difficult for urine to leak and for bacteria to invade and cause infection. In fact, a 2020 study found that older men with overactive bladder symptoms experienced significant improvement after receiving vitamin D supplements. This suggests that vitamin D may play a role in strengthening the bladder lining and reducing leakage. Number 3. It can help calm down overactive bladder symptoms. As mentioned before, your bladder muscles contain receptors for vitamin D. When vitamin D levels are adequate, these receptors help your bladder muscles contract and relax appropriately, reducing the frequency and urgency of urination. Number 4. It supports nerves that control bladder muscles. Healthy nerves are essential for proper bladder control and sensation. Interestingly, the nervous system also has vitamin D receptors, including those that control the bladder. So getting enough vitamin D from diet or supplements can effectively improve how well your brain can control bladder muscles. But how do you know if you're low on vitamin D? Look for signs like frequent infections, hair loss, bone and back pain, fatigue, slow wound healing, feelings of anxiety or depression, and muscle pain. But to be sure, a simple blood test can do the trick. Plus, you might be more likely to have vitamin D deficiency, especially if you live where sunshine is scarce or have darker skin tones. Here's how to give your vitamin D a boost. Aim for 10 to 15 minutes of midday sun exposure most days, but be mindful of sunburn. Fatty fish like salmon and mackerel, beef liver, egg yolks, and fortified foods can contribute to your intake. Talk to your doctor about whether a vitamin D2 or D3 supplement might be right for you. They might recommend taking 800 to 1,000 international units of vitamin D3 daily. On top of keeping your vitamin D levels up, here are some everyday habits for a healthy bladder. Number 1. Drinking plenty of water helps dilute your urine and flush out bacteria. Number 2. Go easy on caffeine, fizzy drinks, alcohol, and spicy foods, as they can irritate your bladder. Number 3. Consider cranberries or D-mannose for potential UTI prevention, but discuss these options with your doctor first. Number 4. Kegel exercises can strengthen the muscles that support your bladder. Number 5. Maintaining a healthy weight can reduce pressure on it. Number 6. Don't hold it in for too long and use the restroom when you need to go. Number 7. Regular bowel movements can help prevent constipation, which can put pressure on your bladder. Number 8. Smoking can worsen bladder issues, so quitting can significantly improve your health. And lastly, a warm bath can help relax tense bladder muscles. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching, and see you in the next video.